Welcome back. The Brockville General Hospital now has a new chief of staff, and that individual happens to be in the studio with me today, and that is Dr. Greg Manning. Welcome, Dr. Manning.
Thank you, Doreen. Nice to be here.
So you just started, right?
I did, yes.
So I understand that you, well, I don't know if you're actually coming right from Newfoundland or if you're coming right from Ottawa, but somewhere in the mix, you were in Newfoundland, right?
Yes, I am a Newfoundlander by birth.
Are?
Yes,
okay.
yes. So I lived there for most of my life, and most recent for about the last 2 years or so. I grew up there and did most of my education and training in Newfoundland, but have lived in Ottawa and around Ottawa for a significant part of my life too. Probably about 8 years in total. I have a fiance who's from Ottawa, so I have tight links to Eastern Ontario.
You do. And did you know of Brockville at that time?
I did. I've never worked in Brockville prior to now. I was well aware of Brockville just from living in the area. And I think, it gives me some advantage to having some lived experience in the area to know the different communities around ours.
Yes, yes. And in Newfoundland, you did work in a rural type of setting, did you not?
I did. So actually, there's sort of two parts of my practice. On the clinical side, when I actually practice medicine, I'm a cardiac anesthesiologist and ICU physician. So I worked at the Ottawa Heart Institute prior to going to Newfoundland. So I will say that my clinical practice was very much a urban, larger hospital type practice. But when I made the decision to get into medical leadership, that very much took me into a smaller facility, smaller community type practice. And when I was in Newfoundland, I worked as senior medical director, which is roughly equivalent to a chief of staff type position, similar responsibilities. But I had a very large geographical area to be responsible for, which was a big chunk of eastern Newfoundland, excluding St. John's, and all of Labrador.
Oh, wow.
So lots of very small communities, lots of facilities, lots of remote communities. So it was quite challenging. So I think that very much brings some great experience to working in Brockville, being a smaller facility surrounded by some larger hospital systems. So I think that experience will serve me well here.
I think it will indeed. Wow, that was a lot of geographic area to
It's
cover.
huge. We're on the road a lot.
I would, yes. Sleep in your car type of thing, it's going from place to place. Oh my heavens. So why did you decide Brockville is where I want to go?
So I was looking for a change. I wanted to work as in executive leadership and physician leadership in a hospital. I started reaching out to other facilities in the province and just found out through Recruiter that Brockville was searching for a chief of staff. So when I started to dig into it a little bit closer with them, it just seemed like a great fit. Good. To be honest. Yes. For the reasons I've mentioned.
Yes.
We're very much looking eventually to get back to Eastern Ontario because that's where we've got some social roots. And the timing seems right. The position seemed right. So I was very excited to jump on board.
And so it's all history now.
Yes.
You're here. You are definitely here. So as a visionary, what do you see that you're going to be bringing to this hospital here in Brockville?
So I think some of that could be motivated for the reasons why I decided to do this type of work. So as I mentioned before, I had a very specialized clinical practice, but one of the things that I struggle with, and I think a lot of people in healthcare in general want to try to do something to fix the system. My practice was very acute care, but I think one of the biggest problems that we have in healthcare in Canada is access to primary care and access to services, particularly from smaller and remote communities. So I decided for myself that I really wanted to make a change and use part of my career to try to, fix those gaps in the bigger system as a whole. So I actually went and sought some formal business training through Rotman School of Management at University of Toronto. That was a big career direction change for me and really inspire me to do this type of work.
Mm-hmm, yes.
So what I would really like to see, it's very clear that this community has a very, great hospital, a very good leadership team at the hospital. And they've really gotten me up to speed in terms of, the work to be done and orienting me to the ins and outs of that facility.
Yes.
In terms of a vision, though, I'd really like to see more of a connection between community partners and our hospital partners.
Okay.
I think we very much have a view of healthcare. We tend to think more of hospital-based care.
Right.
But a lot of, I think, what patients truly want is to be home, to be well. So I'd like to try to, bridge that gap between the hospital and really reach people in their community. So that might be in their home, but also with their family physician or primary care providers in the community. So that's where I think healthcare needs to get. And I'd like to start working on that along with the partners at Brockville General.
When you were talking about that, right away, what came to mind was preventative care. Is this, like, am I in the right area of thinking that's what you want to do with the organizations that you want to partner with?
I absolutely think so. That is the type of preventative medicine. Primary care is what's going to keep people well the longest and live better. I think that really is truly what it comes down to. It's not about just living, but living well.
Right.
So really shifting focus. We'll always have a need for acute care.
Yes.
But we really need to start, as a system, start thinking about what do I need to do at home? How can I influence what I do now to make my 5-year, 10-year, 50 years from now, living the best I can. Right.
And enjoying.
Yes.
Enjoying life.
Absolutely.
And all the benefits that it has. Digitally, technology, how does that fit with you?
I'm a bit of a technological geek, I think, in my whole life, I will say. So I'm very pro technology. I'm a big believer in virtual and remote care. However, I do put a lot of value in that in-person interaction as well. So I really look at the virtual tools and digital health tools as just other things that we have, other strategies that we can reach people in different places or do our job better in the locations that we're at. So I don't think that these are going to replace the in-person interaction and the hands-on interaction. No. But the more that we can leverage technology, I think the better, because we're a very strained industry in terms of resources, and I think these are a lot of good tools that we can use to be more effective and more efficient in our jobs. When
you started at BGH, did you feel that some of their equipment is somewhat archaic, or did you find that, oh no, I mean, this is good because we can work with this and we can add to what they already have? Mm-hmm.
I will say I've been impressed with the facility so far. Good. I will say this with the caveat that I haven't started my clinical practice yet at the facility. Okay. I've only just been digging into the healthcare leadership side. Mm-hmm. But you do have a gorgeous new hospital wing that I believe was opened in 2021 or very early in the pandemic.
Yes.
But but we also see older parts of the hospitals. But I think if you go to a lot of other facilities in Canada, you will see that
dated.
But that doesn't mean that we don't deliver quality of care.
No.
We still all strive to deliver that high standard, and our creditors will always hold us to that. So facilities and equipment is something that's always continually evaluated, and we replace it when we need it, but we charge on with what we have in the meantime.
Okay, I didn't. I guess I should elaborate a little bit more. With you coming from Newfoundland and seeing what happens remotely in the different areas, I didn't know if there was something that you felt you could have access to here at BGH and bring that forward from the technology and the digital side of it.
I think a very relatively new and a very good thing that Brockville General has going for it, along with some of the other regional hospitals, is the launch of the new electronic medical record Lumio platform. So that's going to be pivotal, actually, in terms of being a foundation to build all those digital tools on, and really is something that you need to have to share information between your hospital partners. But, as an extension of that, these digital platforms also can allow you to start reaching people at a further distance, or do that remote and virtual care. So I think that's a very good start. And a lot of other hospitals in the country are moving towards those robust digital health records. Very foundational.
And it makes sense, though, doesn't it? Absolutely. It just does. I mean, it should be. It should be. And finally, we now have it.
Yes.
Which is good.
Yep.
Which is very good. Okay, I know this is an unfair question, but I'm going to ask it anyway. What kind of changes do you think you're going to make to BGH?
At the first start, honestly, I think my approach will be to not change a whole lot. Okay. I am entering a new organization, a new community. Of course, I've said I was aware of Brockville, but I haven't worked and certainly haven't lived in Brockville. No. So I think the first stage will just be to listen and see, there's a lot of things that, you can tell already that are working well here. So not necessarily need to change much at the very beginning. Okay. But we're starting to identify some things that I need to work on with the other physicians in terms of shoring up some of the services that we have. Beyond that, I think it's going to start talking with the community members about, okay, what is it that you think are gaps? Is it that link between the hospital and community services? Is it, you'd rather have access to hospital care in your home, and start to develop, where are those big picture projects that we can start working on? And I think a lot of that will be driven by the vision we were talking about earlier, about trying to get that care closer to home and getting people out of hospitals sooner and living better.
So it sounds to me as if there's going to be like a brand new department eventually. Am I wrong?
I wouldn't say new department per se. No, we still have all the same core services at the hospital, but there's always an appetite and a willingness to start trying new different things. So it might be a different way to run a clinic, or a new procedure that a surgical service might want to operate. And we always talk about, introducing things from time to time. So
yes.
As the practice of medicine changes. So I think you will see, over months and years that, we'll be doing new things. We'll be, very attentive to what our other hospital partners are doing, and just trying to fit into the greater healthcare system.
Yes. So is it true that you have quite the sense of humor?
I like to think that I do. I've told I have a very healthy and hearty laugh.
Yes.
I'm a East Coaster, so I think, stereotypically, I think we're known to be funnier people, or, more engaging and jovial people.
Yes. Now, stress. Stress is a big thing in healthcare, and a lot of people have different hobbies. What do you do to de-stress?
I really like to exercise. I like going to the gym. I like just being outside. I mentioned that I'm a big tech geek, so my fiance and I do a lot of video gaming, so we're of that generation.
Yes.
So, just anything that I can do to, have a bit of a disconnect, I think, from the stress of work has been good. The last few years, I've been sort of dabbling in, mindfulness and music, I think, has been really helpful. So I think it's, whatever works for you. And I've been trying different things, and it's been good. And I think the career change has done a lot for me personally. I get a lot of fulfillment out of doing this type of leadership work, and particularly in addition to my clinical practice now, I think that's going to be very fulfilling. So it makes you feel good, it motivates you to get to work day to day when you see over time that change starts to happen. It's very fulfilling.
I think you're quite right. I think, sometimes in our lives we go along and we don't realize that sometimes we need to be challenged a little bit, and, get it out there a little bit more, and make sure that you're not doing the same thing over and over and over.
Absolutely.
Yes.
Yeah.
Yes. Are you a cyclist by any chance?
I wouldn't call myself a cyclist, but I do enjoy cycling. Yes, I do.
Yeah, because I understand the hospital does have a team that do cycle, and so I just wondered if you would be joining them when they go out for their...
I will certainly explore it. My bike is currently in Newfoundland, but will be arriving sometime in the early summer, late spring when we fully move back to Ontario. So yeah, absolutely.
Well,
actually thought about that recently when I saw the Ride the River advertising. So I'll be exploring that for sure.
Good.
Yeah.
Welcome to Brockville.
Thank you.
And thank you for sitting down with me today.
You're very welcome. Thank you very much.